Driving under the influence of dementia. That's a really tough subject, isn't it? I'm Debbie, one of the mentors with Positive Approach to Care, and I'll be your guide during this webinar. I've divided the webinar up into 5 chapters. Thanks for joining us on this journey. Let's begin. Driving safety for those with cognitive changes, it's a really complex issue. In this webinar, Teepa and her guest, Debbie Ricker, Debbie's an occupational therapist who conducts driving assessments. They explore how family and friends can be informed and begin this conversation with somebody that they care for. This webinar has 5 chapters. I'll put that up now. In the first chapter, Teepa discusses how driving is seen as both a symbol of adulthood and a civil right. The second chapter addresses those missing pieces. Who do we talk to for value information and what's involved in their point of view? Moving along to chapter 3, Teepa helps us think about adopting change. How easy would it be for you to handle a major change, such as not driving any longer? And what about for the person who has dementia? There could be several people who could have this conversation with a loved one. So how do you decide who that person should be? In chapter 4, we're going to get some pretty alarming statistics on driving when dementia is involved. So what are those clear signals that it's time for a new plan? And finally, the wrap up in chapter 5, Teepa talks about the best way to evaluate driving abilities, provide the right kind of support, and also consider our social responsibility. Let's start with chapter 1. So chapter 1, the idea of not driving anymore. After years, if not decades of driving, that requires a major shift in both thinking and behavior. Consider the ease of getting your first driver's license and then renewing it every few years. If you got your driver's license as a teenager, driving probably felt like a rite of passage into adulthood. Oh, the freedom of not having to ask a parent to take you to meet up with friends or go to a sporting event. And that freedom is huge in our society. It's a whole lot more than just getting from one place to another, isn't it? Before we join Teepa, consider for a moment the question on this next slide. Now let's begin with chapter 1. Here's Teepa.
So my goal in this topic and in this session is to talk about what's going on and then to spend a little bit of time talking about what to do and what not to do if you want to try to help well when people are struggling with and beginning to have issues with driving because of the diagnosis and the condition and the symptoms of dementia. So what I would say is it's really important for us to recall in our whole approach to this that dementia and driving are 2 very different things. Driving is something that typically most adults view almost as a civil right. I mean, unless I do something really wrong, I'm in a horrible accident, I'm driving while impaired, I should be able to drive as long as I don't cause a lot of trouble. And even if I have some fender benders, people have accidents. So it shouldn't be a big deal. Or, once I start having accidents, I don't like having accidents. That makes me really nervous. But the other piece of driving is it's really a symbol of being an adult and having autonomy. And as we live our life in the US, at least, and in Canada, Driving is our way of getting where we want to be when we want to be there and getting back home when we want to get home. So when we can't independently drive, it means we lose more than just driving. It means we lose our life the way we currently live it. And so this is not a minor shift. This is a major change. And rarely, if ever, do we think through it like that. That if we are not really thoughtful, we may be underestimating the impact of driving or not driving on someone's life. So the sense of privilege, I think sometimes we forget that you learn to drive frequently so young that you take it for granted. And you did have to develop skill, and you get your license when you transition from being a kid to a teenager in most cases, or in young adulthood. But we maintain our license with very little effort. So we do a little checking in. So our eyesight may get screened, or our ability to recognize signage may get noted. The ability to recognize and say, what are the rules of the road? How do you do these things? And as long as you don't have a major neurological event or a seizure, typically you can keep going until such time as, well, we aren't exactly sure. Occasionally, however, if something medical happens, you may get retested. And if you get caught drinking while you're driving, you may get stopped. But beyond that, how we get people to stop driving is a lot less organized than how we allow them to start driving. We don't have an exit plan or an exit strategy as a society. And so it's based on individual awareness and knowledge and risk-taking behaviors and support systems. And so it's not just about actually having dementia. There are other issues involved in driving. But as a rule, our social fabric has not quite adapted to the graying of America, and we do not have plans in place. And that's just a reality.
So to summarize chapter 1, the willingness to retire from driving, it's based on self-awareness, risk-taking behaviors, support systems, and alternate transportation options that are available. When we think about self-awareness, we look in the mirror and we say, I'm doing fine, I got this. Or we might look in the mirror and say, I need a new plan. Somebody help. We also have to consider risk-taking. Is that something that this person always did, or is this something kind of new? Has driving become risky or downright dangerous for that person, maybe also for others? And who can support this decision and the change that's going to happen if driving is no longer an option? What are the alternative means of transportation for getting around? That can vary tremendously if you live in a rural area or an urban area. And do the options meet the person's idea of what's reasonable, affordable, and convenient? As we move into chapter 2, we're going to talk about what information should be gathered and who we can gather that information from. So chapter 2, the missing pieces, gathering information and exploring alternatives. How do we gather the information? What do we need to know? Who do we gather the information from? As a family member, friend, or professional, are we willing and able to support the necessary changes and the ramifications of those changes? If mom doesn't drive, who takes her to the grocery store, the doctor's appointments, the nail salon, church, the beauty shop? You get the idea. How acceptable are alternative driving options? Before we return to the webinar, think to yourself about the question on this slide. Now let's hear from Teepa.
So when it comes to dementia, what are some of the things we tend to be missing? And what I'd say is that we are not really good at collecting information from the person living with dementia. We don't start with, tell me a little bit about how you feel you're doing with your driving. Talk to me about what you've noticed or not noticed. Are you noticing anything about driving that feels different or starts to feel risky? Tell me how you're feeling about it. Are you saying that you notice anything with your eyesight or reaction times or driving in the night or going to unfamiliar places? So once I go through the list of things that might be our first indicators, I need to be curious, not judgmental, if I'd really like to be helpful. So I don't want to be saying, I'm noticing you're having trouble. I want to find out, are you noticing you're having trouble? Because if I come into this like I know something you don't know, I'm much more likely to put you in the defense mode, and you want to defend your right to drive rather than acknowledge, well, yeah, I'm having a little more trouble. My speed seems to be down. I do find that I'm more nervous about pulling out. I mean, much better to have a conversation without causing the person to get distressed or to recognize, you know what? They totally aren't noticing what I'm noticing. So was there anything when you were driving today, Mom, that you noticed that was a little different than when you usually drive? I don't think so. Huh. So, we were going to church, and I know we ended up going to the grocery store. Did we ever end up at the church? Oh, no, I decided we didn't need to go to the church. I decided going to the grocery store was a better idea. Well, if that's the case, then what I'm going to tell you is, unless that's a pattern my mom has had for a while, that just gave me a whole lot of information about her inability to pick up on the same cues that I've been picking up on. So there's no point in arguing with her because she didn't get it. She totally was unaware that she was going to church, and she cruised right by church. She went to the grocery store, and what she's doing is telling me, oh yeah, I made that decision. It's like, no, she didn't. She forgot what she was going to go do. Now, that doesn't seem like a big deal, but what if she thought she was going home and instead she was going to get gas, and she doesn't get gas, and she gets to look at the gas gauge. And so now she's out of gas, but she's nowhere near home. Now she's off the side of a highway. She won't know where she is. And the question will be, will she use her cell phone or will she not use her cell phone? So these kind of things, if I have a better sense of what does she understand and what is she picking up on, what is she not, what is he picking up on, what is he not in a threatening way, but simply to try to figure out where are they coming from. And the other piece is, what do they tend to do and what do they need to do with driving? And does the habit and the routine that they have, is it matching what their current needs are, or is it changing? Do we need to start looking at what other modes of transportation and support are necessary for them to be able to do all the things they want to be able to do when they want to be able to do them? So a perfect example is people can be quite fine driving during the day, but driving at night is a total another story. Eye ability, reaction speed, ability to go light to dark, dark to light, recognize objects and places when there's less lighting, can be a real challenge, added to which fatigue as the day wears on can create its own problems. So looking at when I drive, not just where I drive, can make a big difference. So my first change might be that I need support at driving at night. I'm actually okay during the day, but not at night. But it takes figuring this out to figure that out. The second thing I would say is for friends and family, trying to sort out what they believe and think about driving and whether or not their opinion about driving is colored or influenced by what it would do, not just for the person, but what it's going to do for them. Would it change their life? Would it create barriers or boundaries for them, making it like, oh God, I don't know. I don't really want to cause trouble right now. He gets so angry about this. So is it a problem with, I don't want to ruin our relationship? I don't want to limit him in his sense of freedom. Or if I have to go over there every afternoon that he likes to go over to Hardee's or McDonald's or whatever, then that means my whole afternoon is tied up taking him and dropping him off. And I have also kids, and I've got to figure that out. And so sometimes people allow people to continue doing things because it's convenient, not because it's smart. And so really checking out with family, tell me a little bit about what you think is happening. Do you have a sense that their driving skill is still adequate, or do you see it changing? Do you think when they need to drive and how they need to drive is still working for them? And again, I just don't routinely find that we're doing a very good job of checking these things out. We make assumptions. We don't do assessments. We don't even screen. And then the final population that I think we don't always get good information about is medical advisors and others in the health field. But what do they believe about the person's abilities? Are they actually looking at their abilities? Are they simply using a global statement of somebody has dementia, I don't think they should be driving. Somebody's in the middle of the disease, I don't think they should be driving. Somebody's just been diagnosed, I think they should drive for about a year, and then I think that's it. I mean, it's amazing that there's so little data about decision-making related to dementia and driving for the medical profession. And when I just did the session with the people who are living with dementia, they said one of my folks said that he doesn't trust doctors to make good recommendations based on the individual's abilities, because he believes, and he used to be a lawyer, I'll be honest, that there's this secondary thing of being afraid, well, it could be on my medical practice license. If I say somebody's still able to drive, they end up having an accident, then I could be held liable. So the safest and easiest thing for me to do is to basically, if I am diagnosing them with dementia, to indicate that they shouldn't be driving anymore, because then there's no liability involved. So the point that the person was making is it's not based on ability, it's based on not wanting to get sued. And so if we're working with people who live with dementia who are smart, they're going to say, he isn't doing a good evaluation. And you know what? That person would be correct. Because in that case, we aren't actually using the person's ability or even the type of dementia. We're just using the global term dementia, which is a syndrome. It's not even a diagnosis. And depending on how early you go in, you may be limiting your life way before your abilities limit your ability to drive. Because you have evidence in your family, other people have had the disease. You're having difficulty at work. And so people with young onset, but people also who are older, who may be more competent to drive than their peers who are younger, who simply don't go in to be evaluated, don't get the opportunity to continue using skill they do have. And they may also be losing more than that skill. They may not be socializing as much anymore. They may not be engaging people as much anymore. They may not be going to activities or exercising as much because now they can't get to the park. And you can't go to the park from where you live unless you drive, unless you know somebody who will take you. So the whole thing is complicated. So the other question we do not ask all too often is what alternatives actually exist for getting where you want to go when you want to get there? What options are out there? What skills do you need to use those options? How do those services that you might be trying to use impact your self-directed lifestyle, your long-time roles and responsibilities, safety, and your own income? Because not everything is free. And not everything is easy to use. And not everything is available when you'd prefer to use it. And not everything makes you feel like an adult. And not everything is actually something that makes sense, because it doesn't necessarily go where you want to go when you want to go there. So one of the questions we should be asking, and all too often we aren't, is how acceptable or unacceptable are these alternatives to a person living with dementia, but I would say any of us who, due to something happening to us, we're no longer able to drive. So as far as we know, I don't have dementia now. But if I couldn't drive, my life would be very, very different. Is it possible I could still do what I do now? Possible, but it would sure take a lot more organizing and coordinating to get me to airports and out of airports and to hotels and from hotels, and for me to go get what I need when I need it. So it would change my whole life. And I don't know why we would think it wouldn't do that for somebody living with dementia. In my brain's ability to handle change, probably pretty decent. When you're starting to develop dementia, the idea of having to change a whole bunch of things at once gets overwhelming. And so better the devil I know than the devil I don't know. And so people continue to drive because the idea of changing too many things just becomes, I can't do that. I can't even contemplate doing that.
As we move into chapter 3, Teepa will discuss how we adopt change and who should be involved in this conversation. There might be several family members, friends, or professionals even who have concerns about an individual's driving. How do you choose who starts that conversation? Who's the authority figure? Who can support, and how do they support? How do you even approach a person when you've had these concerns? And you may have had these concerns for a while.
So the last question I think we don't think enough about is who is a friend to the individual who we're concerned about, and who is an authority figure for the person we're concerned about? Because change is going to be hard. And if driving plays a major role in people's lives, they're going to need support. And they may also need guidelines that require monitoring and boundaries that are based on reasonable and what is important to that individual. So I want to figure out who the authority figure is. Who do they respect? Who do they have a relationship with that we could say, you know what? I got it. You hate it. But for right now, what the doctor is saying is we need to make other arrangements. So I'm going to ask you for a favor, and I'm going to say for right now, I'm going to do the driving. And I know that ticks you off. I know it makes you frustrated, but for right now, that's what we're going to do. That'll only work if I'm seen as both a friend and authority figure. If I'm going to try to do something like that and the individual doesn't see me that way, it will rarely result in a good outcome. So I'm going to pause here for a second because I want to introduce somebody else who's on the webinar with us, and I'll quit sharing for a second. And her name is Debbie Riker. And Debbie actually is a driving evaluator in California. She's an occupational therapist, and she does a fair amount of work for people who are living with dementia. So Debbie, would you like to just sort of share a few pieces of information or thoughts you have at this point?
About the testing or questions that people might have in general?
Sure. I would say about your experience with people living with dementia and their families and physicians in regard to this whole thing, and how prepared we are to actually be supportive versus just confrontational with driving.
Okay. So I'll start with the physicians. There are some physicians who report to me on a regular basis when they see people in the office and they have concerns about their abilities, then they'll refer to me. But I also have seen several neurologists in my area who are afraid to tell the person that they have a diagnosis of dementia and won't even say, you have a diagnosis. Because their theory is that they want the person to be happy and live their life and not be encumbered by that diagnosis. So in the physician community alone, there's a varied response to this. With the family members, it's also a varied response because sometimes the family really are concerned about the individual's ability to drive, and they don't want anything to happen to their loved one. They don't want them to harm anyone else. And so they'll say, I really want this person tested so that we know for sure whether they're safe to drive or not. But I do get kickback sometimes from the family because it's difficult to be responsible for taking your mother to the grocery store and pharmacy and everywhere that she needs to go. And so sometimes it's hard for the family to go along with having the testing because they're afraid they may have to be responsible for everything that's going on. So it's a variety of responses that I see from the family. For the individuals with dementia, it's very rare that a person will say, you're right, I really am having a lot of problems with driving. I will stop driving. Most of the time I get kickback, even though I have evidence of multiple serious mistakes that they've made on the driving test. usually they say, well, I was driving your car. If I was driving my car knows where to go. I don't ever make these mistakes in my car, so therefore it's your car's fault.
So what we're talking about is the inability to recognize that it's my ability that's changing, not the car, not the road, not the way I'm going. And so in those cases, now I'm going to need different support, because telling me that you're right and I'm wrong is not going to keep me from driving. All it's going to do is make
Correct.
me pissed off at you. And you're an idiot, and I'm not going to do what you said.
Yes.
So
Yes.
the idea that evidence alone is the answer is what gets us in trouble. We keep thinking we can help them understand. And it's like, well, but the part of their brain that lets them understand is the very part that's not working. So I've got to come up with some different strategies, because that simply isn't going to cut the mustard. It's not going to keep them from doing it. And as a matter of fact, what it will tend to do is make them try to hide their driving behaviors from me, because they are not at a place where they're stupid. They know if I find out they're driving and I find out they're doing those things, I'm going to come down on them. So what will happen is they'll try to drive without anybody knowing about it. So that might mean they decide to drive at night rather than during the day, because I would know if they were driving in the day. So I've actually increased their risk of having an accident rather than decrease it. So it's a tricky thing.
As we heard in chapter 3, you need to have a plan. You've gathered information, you've decided who starts the conversation, and how everyone involved is going to support. And support is empathy, it's not sympathy. As we move into chapter 4, Teepa discusses why this is really a big deal in terms of risk and danger, both to the individual and to others. What are the signals that something has changed and it's time to face this issue head on, instead of constantly opting for that quick detour? Let's rejoin the webinar.
So what I want to do now is talk a little bit about what we know is going on in the field of dementia, and what the numbers are and why this is such a big deal. Because I think it's underestimated by most individuals. So let me talk a little bit about what we know about this situation, and we'll come back to this. We know that we've got over 5.3, probably up to 5.8 million Americans who are living with dementia diagnosed. Now, that's not the people that have the diagnosis, but they don't have the diagnosis yet. So, and it's not even a diagnosis. They actually are having brain change, but nobody's noticed it enough to get them worked up and evaluated. Even with those numbers, the estimates are that somewhere between 30 to 40% of people who are in the middle of the disease, not early, in the middle of the disease, are still driving. And they're still driving because to not drive would change their entire lifestyle. They would have to change where they live, how they get where they're going, how they get their food, how they get medical assistance, how they meet friends, how they socialize, how they go to a faith-based organization. The only places that driving are not essential are in big cities that have a great public transportation system that people are used to, familiar, and it becomes the norm for living in that city. Unless that is the case, or they're living in a self-contained community, people still drive. And people drive because that's how we get around in the U.S. Our public system is relatively weak, and our family support system is more fractured than ever. By mid-disease, the risk of having an accident while you're driving is much higher than any other life situation, including new drivers, teenage drivers, drunk drivers, and drivers who have accidents when they drive when they're too tired and fatigued and they're distracted. So people on cell phones, people with mid-stage dementia have more accidents than any other population. And at the end of the day, the other thing that makes this a real problem is that in the motor vehicle accidents that they have, when we're talking about somebody having dementia and being a driver involved, These accidents are more deadly and they result in more serious injuries for both the person who has dementia, but people around. On average, the people who are involved, if there is a death, we're talking about 2 deaths, and it often involves another motor vehicle because of the mistakes that someone makes. It may indeed involve the individual, but they are more likely to be injured and the other person is more likely to be killed, although both can and do occur. We also know that in this case that some of the symptoms of concern are as follows. So if you're seeing these symptoms, we should be getting curious and concerned and starting to put a plan together if we haven't so far. Getting lost on familiar routes. Having a slowed reaction time resulting in near misses so that when you're in the car, you're like, oh, jeezy Pete, Dad, oh my God. And you find yourself putting your foot down, trying to put the brake on or trying to imagine that you have the wheel or, and you're finding sounds coming out of your mouth and vocalizations like, oh, pause, whoa, 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 whoa. Hey, hang on. It's green. Stop sign. And that's not their usual pattern. Now, if they've always been like that, it's a little trickier. We also want to look for errors in turning. And the first turning errors we tend to notice that are related to dementia are left-hand turns, turning to your left across intersections with oncoming traffic. So there's not a green turn signal that you can take advantage of. You actually have to watch the traffic and make the judgment call of when to pull out. And so the most common accident is a T-bone, where you make your turn, but you waited a little too long and you're going to get slammed in the side or you get your car spun around. The other kinds of signals that you might have that people are having some trouble is when they go to change lanes, there's errors. When they're backing up, there's numbers of errors. At signal lights, they start to make mistakes about when they stop, how far into the intersection they stop. Trying to back up in intersections when they have made a mistake, staying in the middle of the intersection, not knowing what to do. Had a lady recently that got in the middle of the intersection and she got so panicky. She normally was fairly intact. What she did is she took the sunroof, because she had a sunroof. She came above the sunroof and started waving her hand like she was at a parade. Because all of a sudden in that moment, her brain goes, I'm in a different place in time, because everybody was looking at her. So she had stopped the car in the middle of the intersection. So she just was doing the parade wave. And indeed, she used to be in a lot of parades. She was a beauty pageant queen. And so in that moment, her brain took her to a safer place of why you would be stopped in the middle of an intersection. But that was also the moment when everybody around in the family suddenly realized this was more serious than they thought it was. That mom actually got so confused that she thought she was in a parade again when she was 82. Yeah, it was time to do something. Pulling out into traffic and judging distances from car to car, also indicators. Emotional distress, people who get really angry or frustrated. But we want to be careful that it's different than their whole lifestyle. My mom was always an angry driver. She got angry all the time. She talked to drivers. She kept her windows up because she talked to drivers, and she wasn't nice when she talked. Unfortunately, we were all in the car, so I've learned some bad habits. But I try to manage them. I will tell you, though, that she thought everybody had made mistakes, and it was everybody's fault that she was in the wrong lane at the wrong time, and they pulled over. And so it was harder to tell when she was having trouble, but it became obvious when she started putting both hands up in the air and no hands on the wheel to let drivers know they were making mistakes, that we had moved past the point of it being a verbal issue to losing control of the motor vehicle. She became so distressed at somebody else's behavior. Multiple fender benders or scrapes. The speed of driving is too fast or too slow for what's going on around the person. They rely on a co-pilot for directions and information. Do I turn here? Do I turn here? Up at the light. Where? At the light. Where? Which light? The light up there. Which way am I turning? Right. You're turning right. That's why you're in the right lane. Well, which way is right? That's to a place where, whoa, still driving and having those kind of issues with direction finding, that's a bit of a challenge. Warnings or tickets from police. And I have worked with individuals who had over 100 citations and they were still driving. They had them all in the glove compartment. So when you open the glove compartment, they'd all come shooting out. A lot of them were parking in the wrong places, not putting money in the meter, but it was also fender benders backing into those parking meters, scraping the mirror off the side, bumping into somebody's car, getting caught going through stop signs and not noticing stop signs. And yet they kept driving. They even drove when the license was taken away from them. And people weren't sure what to do about that. And so I got called in to try to help. Confusing the brake pedal and the gas pedal. And that seems like that might be something that was pretty profound, but it only takes a second to think you've moved your foot over when all you did was not move your foot over. And you're slamming your foot down on the pedal, but you're slamming on the gas, not the brake. Or you're slamming on the brake and you thought you're putting your foot down on the gas, and the person behind you thought you were going to do that too, and they slammed into the back of you. Another one is called drifting. And drifting occurs that if you want to, you can actually try this. Put your hands like you have them on the wheels on the steering wheel at, let's say, 10 o'clock and 2 o'clock. And then look straight ahead, but now look over your right shoulder. And drifting is where you start to, when you're looking over your right shoulder to see if anything's coming, your hands are moving, your shoulders are moving with your head turn, and you will also see it to the left. And so what's starting to happen is when I shift my gaze in the car from side to side, my car is starting to shift with me because I'm not able to keep my arms focused straight front while I make that turn and that look over the shoulder. We see it on bicycles as well as in motor vehicles, and it tends to result in increased injuries and accidents with bicycles as well. So when you're driving, realize it's not just people living with dementia in other motor vehicles. It could be people on bicycles living with dementia who might pose a hazard. And so the idea that people around you are as much a risk to you as you are to them sometimes when you're living with dementia, because you can't anticipate what they're going to do as quickly and as reliably. You might also find that the person is not noticing signs. They're missing pedestrians. You're having to say, oh, whoa, 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 there's somebody, mom, they're coming across. Whoa, 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 stop. There's somebody coming across. Did you see them? They're right there. Signals that the light is changing, or running over curbs or bumping into things. And not really thinking about it. So the bottom line I use when I'm trying to help people make choices and decisions is, would you let your child or grandchild ride with this person? And if your honest answer is no, I mean, of course not, then we have to ask, well, then why are they still on the road? Because people's children and grandchildren are out in other cars. So we really do, there is a public health hazard for people living with dementia who are still driving when capacity is no longer adequate for driving.
To summarize Chapter 4, we heard about the symptoms of concern that require a new plan. As a passenger, you might observe slower reaction times, getting lost on familiar routes, multiple fender benders that are very casually explained. I don't know how that happened. Somebody must have bumped into me. Speed and lane drifting. And maybe confusing the brake and the gas pedals. Yikes. When you look at the car, you might see some new dings and scrapes that weren't there before. The significance of the risk for driving with impaired cognition, particularly mid-stage dementia, results in more accidents than any other cause of accidents, and more serious injuries and even death. Teepa's bottom line: if you wouldn't let your child or your grandchild ride with this driver, they probably shouldn't be on the road driving. So what's the fairest and most comprehensive way to evaluate a person's driving ability when cognitive changes are occurring? In this last chapter, Chapter 5, Teepa addresses this question, along with her thoughts on some of the popular recommendations that are out there. Lastly, we are prompted to think about the state and national standards and our own social responsibility to inform and support safety.
So there's lots of pieces of your brain that are impacted by dementia. And the idea of, do you need to stop driving right away? Do you need to stop all driving right away? No, the answer is not necessarily, but it sort of depends on how soon you come in. And that's why people like Debbie are incredibly helpful, because they can help us look at the situation and say, yeah, I'm right. We're really going to have to deal with it now. Or, oh, I was getting a little carried away. I mean, they actually can still do some things, and I need to make sure that we're monitoring, but as they actually are still able to do things. And so, Debbie, I want to ask you, have you had some folks that when you've evaluated them, they still actually are able to drive motor vehicles?
Absolutely. Some are able to, but usually what I recommend is that the doctor refer them back in 6 months to a year so that we can monitor their ability.
Yeah, and that's a real reasonable time frame. Or if something else happens that's pretty significant, we want to have people back. If male, I'm going to add particularly, start experiencing symptoms of depression, significant depression. One of the ways that males are quite effective with end-of-life decisions is they use motor vehicles because they're powerful tools. And males, when they can't stand living anymore, can use a motor vehicle more effectively than females to end life. So I would say death by motor vehicle is unfortunately what some people choose. And unfortunately for families, it's often a devastating phenomena because to have that happen, you always live with the dread of should I, could I probably should have, and I didn't. So if someone starts to experience major depression as their dementia progresses, that's also another time for a reevaluation, because depression in and of itself can affect your ability to drive. And people underestimate that. On the other side, if people are starting to experience more mania, they're getting really excited, they're jazzed up, and they're moving at a high rate of speed, and they don't think things through, and they're getting more impulsive. That would be another time to really consider the possibilities. So what we want to do is really look at some ways in which, and you can look at all these brain pictures, many of you have seen them before. What I'm trying to show is that there's really organic reasons why people are not able to drive and drive safely. And it's really not the person, but it's also the same reason they can't see what we're saying, which is that their brain thinks they're doing okay because a part of their brain that allows them to realize they're not doing okay is broken. And what I have here, and if you want to look through them, that's fine. And if you don't, that's fine. I actually pulled up, and I'll see if I can get them to pop up, some of these sites that are information for folks. So this is a caregiver tips and tools, driving dementia, is it safe? And so these are things that people have written, and this is the Alzheimer's Association that's done this, and there are good pieces of information in here. But I'm going to go over to the left-hand side where they give you some caregiver tips, which is preventing driving when it's unsafe. I'm just going to read some of these out because I'm not sure that I would agree these are good decisions and good ways of addressing this. And so I want you to hear what's being recommended. And I'm going to tell you it's not my best way of dealing with it in the way we try to help people. So here's the first tip. Remember, you may need to be firm in your efforts to prevent driving if it is unsafe, or if your loved one wants to drive regardless of having a license or not. Because I rarely find that being firm with someone, if you're a family member, will necessarily result in a good outcome. It may get you hit, it may get you hurt, and it may actually make a relationship more challenging and a person more committed to driving. So I think we need someone to be firm, but I'm not convinced it should be a family member in many cases. I think they agree with the individual. They hate it. They think it's miserable. But for right now, I think we better try to do what they've asked us to do. And I hate it. I hate it for you. I would rather have a family member validate and agree that it's hard than I would have them be firm with the individual and try to get the person to behave themselves, because I think that's what gets us in trouble all too frequently. The second recommendation, control access to the car keys. Take the keys away from the individual. Some families have fake keys created to provide a sense of comfort to the person. I would say, I hope the person is really far along when you do this, because if you do it too early in the process, the person is not stupid. So they know something's happened to the car key and there's something wrong with it. And they either get a locksmith to figure it out, they get a new key made, they call AAA. So if you're going to use this technique to provide comfort, a key that doesn't actually work, that has to happen a little later in the disease, because early in the disease, people are really pretty smart about what's going on here. And most family members aren't that good at lying. And trying to take keys out of somebody's hands who believes they should be able to drive is basically setting yourself up for a huge argument, and maybe even getting hurt, because males who don't think females have a right to tell them how to do their life, or daughters who don't have a right to tell dad what to do, or sons that don't have mom, what ends up happening is you're setting yourself up in a confrontational mode. And again, yeah, you may stop them one time, but this isn't a one-time deal. Driving is something that comes up frequently. So I think we need to build our skills. But as a first cut, these aren't my first recommendations. It's not that I'm never saying never, but I think as a recommendation. Have a car go into the shop for repairs and tell the loved one the part's on order and it's still being worked on. That can happen maybe later in the disease. Early in the disease, people aren't always, it's not the type of dementia that their sense of time is damaged. And so they're going to be wanting to know, well, how long is the damn car going to be in the shop? This is bullshit. I'll just get it to another shop. This is ridiculous. You've been saying that for 5 weeks, because not everybody who has dementia has time awareness problems. So again, it's not that it's totally awful, but I'm cautious about these things, because I think when you start telling untruths, and we haven't checked out what's the person really telling us when they're telling us they have to drive, they need to drive, I think we're missing the point. Because what they're really telling me is something about driving is so vital that I can't seem to be willing to give it up. And I think we have a responsibility to try to figure out what that is, and to also grieve the loss of that with them, rather than trying to make it okay. Because it's pretty evident it's not okay if they're still wanting to drive, even though they have trouble recognizing their loss. I do agree with transitioning the driving responsibilities to others. I don't agree with eliminate their driving by always jumping up and grabbing the keys first. I think saying, do you mind if I drive this time? I'm trying to get the route under my belt. How about if I drive this time, you drive next time, because I want to get it out of the way, and I want to see about stopping by the store on our way. Come up with a strategy, but grabbing things makes me nervous, because when I tell somebody to grab something, it means I'm moving fast and I'm anxious. And if I get anxious, the person that I'm trying to get not to drive will start to become anxious about my behavior. And so I don't recommend that piece. Offering alternative means of getting places, I agree with that one. And having a higher authority blame for them not being allowed to drive. I think the blaming is one, but I think we need to have a strategy for how to deal with it. And there are some physicians who do not want you to blame them. And you better know that ahead of time, because if they don't want you to do the blame, then when you come into the office, they'll say, I never said that. That's your wife saying that, which is really going to boomerang. And finally, I do sometimes find that writing no driving for right now. I think for right now is a really important phrase, because I think asking people to give up driving forever at the beginning is way, way, way difficult. I think for right now helps the person begin to adjust and adapt to this idea of not driving in a way that doesn't totally rob them of that entire experience forever. And I think we need to be thoughtful about that. When you take away all hope for the future, that's when people will put their feet down and go, well, if I'm never going to drive again, then you're not going to stop me yet. I can still drive. Versus we're not going to drive right now. That means there's a possibility for the future. But right now, we're not going to. Sell the car and donate it to a charity, only if they really care about that. Otherwise, it's known as theft. And I'd be real cautious about it. Make sure you have the authority to do that. Or they might take you to court. And then validate their desire to drive. And I would say, rather than sympathize, empathize. And that means I know exactly how you feel is absolutely the wrong thing to say. It's got to, I hate it. And I hate that it's happening. And that's known as empathy, not sympathy. Telling you, I know exactly how you, yeah, I know it's okay. It's got to be hard. That's real different. And I think we way too often minimalize what it is that people are experiencing. So you could go through the rest of these. Some of these resources that I pulled up are quite good, and some of them are just interesting. I would say that 10 years ago, doctors were basically saying, as soon as you got your diagnosis, you shouldn't be driving anymore. And now there's more physicians going, we have to evaluate whether you should be driving anymore, and when you shouldn't be driving anymore, and where you shouldn't be driving, and how much you should or should not be driving. And the interesting thing is, with the latest technology, it's possible within 15 years, we'll have automatic cars where even if you have dementia, you can still go somewhere because the car is responsible for you getting places, not you. So there's all kinds of things that are in the offing. For right now, what I would say is, I wanted to share with you a couple of things that are out there. And this is just preliminary. I think ultimately somebody like Debbie is a great resource, but I think there are ways to sort of just get started. And I think all too often they're not used. For medical professionals or even for families, if you do something, what you might look at is something real simple. It's called a trail making screen. And you can go online and find this. This is what it looks like. And what you're supposed to do is use a pen, and you're not supposed to pick your pen up from the paper. And you go 1A, 2B, 3C, 4D, and you're having to find and go from number to letter to number to letter all over this piece of paper. And the idea is you're having to shift focus from one thing to another, and yet maintain focus to remember which number was I on, which letter am I on, where do I find it on this field, and then where do I find the next one. So what it is meant to sort of approximate in a very beginning way is your ability to do hand, eye, and body. And for instance, look out the windshield at the road in front of you, glance in your rear view mirror to see what's behind you. Put your turn signal on and notice the speed you're traveling on, and then glance to your right to see if there's anything beside you. Then look back to the front, check the rear view mirror, check that radio because that song is not the one you like. Reach out and push the button on the radio at the same time, not at the same time, but immediately after. So this trail making thing is meant to sort of look at your ability to switch, 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 switch in a timely fashion. And we're looking also at how quickly you can do this. So it's a real quick way to get you looking at, ooh, I'm having more trouble than I thought I was having, even on a paper and pencil test. This isn't even getting behind the wheel of a car and doing anything. It's simply trying to get your eyes and your hands to do things that aren't as familiar as you think they are, even though A, B, C, D, E, F, G is easy, and 1, 2, 3, 4, 5, 6, 7 is easy. When you put the two together, just like when you put together driving, it's a lot more complicated than people tend to think. And we do it without thinking because it's habit and structure until our habits and our structures start falling apart. So I'm going to pause here because what I want to do is allow folks a few minutes at least to ask some questions and talk through some things that they may want to talk. So I'm going to open it up. If folks have some questions or some concerns, and if you'll put your hand up, we'll sort of identify, or you can chat if you prefer, with some of the things you want to hear about or talk about. So Reverend Mary Riza is asking whether there are places you can go. There actually are. Debbie, do you want to describe where you work? And there are lots of those kind of clinics these days where people can get evaluated.
So I have a business that I actually drive to the individual's home, but there are 2 other programs in the county that I work in, and they're both at hospitals. And so there's a variety of places that can offer that. But I would really look for someone who's an occupational therapist because we have a medical background. And so the first hour of the testing I do is pencil and paper testing. One of the tests that Teepa showed is one that I use. And then the second half of the testing is the driving assessment. So I would look on the American Occupational Therapy Association website, and they have a listing of all the occupational therapists in the United States who do the driving assessments.
And as Debbie said, there are outpatient clinics, and physicians can make referral. So if you ask your physician, I would like a driving evaluation done by, and I would prefer an occupational therapist as opposed to a driving instructor, because driving instructors essentially are trained to help people who are teenagers or adults drive and get their driving license. They aren't necessarily somebody who understands dementia. So I'm a little cautious about those recommendations, and I would prefer somebody who is competent in the area of dementia as well. All right, so what kind of things could we be looking at? And what I would say is these are the hardcore skills that people do need. Reaction speeds, and that includes eye-foot as much as eye-hand, visual field function, visual scanning, depth perception, visual motor integration, bilateral integration. But then here are our challenges. There are currently no national or even statewide guidelines for dementia-related conditions that are ability-based. We have nothing at the national level or even at a state level that bases your ability to drive on what your abilities are. So if you are diagnosed with dementia and your physician sends in something that says they should not be driving, then you will have your license revoked, even though it wasn't skill-based. So if it were me, I would go ahead and say, I would like to be evaluated by someone who evaluates my skill, rather than going simply with the opinion of someone who sees me medically. Because at least I have a shot at keeping my abilities, if indeed my abilities are enable me to drive and not just a diagnostic label that I went in to try to figure out what was happening in my brain. And now I'm no longer able to live my life, even though I went in really early because I was having trouble with word finding. Because what the kind of dementia I might be having is primary progressive aphasia. And it's a language deficit at first. But now I'm being told that I can't do the other things I am still able to do simply because I have that label. So right now it's a very unfair system. But I would also say there's also way too many people who are still driving and nobody's keeping track of that. So that's a problem because we don't have a stopping system that's routine.
Hey, Teepa.
Yes.
Reverend Mary was also asking, and this may be a question for Debbie as well, how is one's insurance affected? Does a diagnosis cancel their insurance?
Debbie, do you want to speak from California? And then I can also chime in for other areas as far as insurance coverage if you have dementia.
The problem is that if you drive with a diagnosis of dementia and you get in an accident and they find out that you have dementia, they can sue you. So I don't think that the insurance would cover them. I know that California has the most strict state laws for doctors referring people with dementia for a driving test. And there are now, I believe, 46 states that have a law about it, but they vary in how they actually enforce it. And actually, we have a problem in California with the DMV. I have had multiple family members call me and tell me that their loved one with dementia was helped to pass the test at the DMV.
Yep.
By the DMV workers. So we don't have a good enforcement policy.
What I would also say is elsewhere, it is not actually your insurance that's the problem, is that you will be sued civilly. And if you carry a diagnosis of dementia, they can take, it's not about your motor vehicle. They can take all your life savings and they can take your home away from you. And so we have had multiple situations where the person was not at fault. They were not the one that caused the accident. The person living with dementia had nothing to do with the accident. Somebody ran into them. They ran into the back of them because the individual had stopped at the stop sign and the teenager ran into the back of them and jammed them right up through there. But the family of the teenager sued the couple that was in the car, and they ended up taking all their life savings. And because the person had carried the diagnosis of dementia, even though it rear end collision and the person had been stopped and the kid jammed into the back of him, they hadn't done anything wrong. They still lost everything in a civil suit. So it's not just the insurance. What happens, even if you have insurance, we're a very litigious society. And so if folks find a chink in the armor, we have numbers of lawyers who are using dementia as the leverage point at which to go after people's resources. And it's becoming more and more of an issue for people living with dementia. And so people are often choosing not to drive in order to not end up in those situations because the risk is quite high and it's getting higher all the time. As more and more legal systems find out about this dementia thing, they're starting to look in the closets to see if you have, do you have a prescription for Aricept? Do you have a prescription for Namenda? Then they don't even have to, as far as they're concerned, that's evidence that you should not have been driving. So it's getting trickier and trickier because we do not have a system for how to do this. And it's really ultimately unfair to people living with dementia in a big way because other people can be really poor drivers and they stay on the road and nobody's asking them to get evaluated. People with cataracts, people with glaucoma, they're still driving because nobody's actually picking up on it and making recommendation. But once you get a neurological condition, people are making that recommendation. So that means it's been an hour. I do want to just mention a couple of other things before we wrap up. One is that if you have a situation where the person still seems like they're doing okay, they still have the skills, we still need to monitor. And I would say that's the point at which we should start the gradual reductions. We should limit distractors in the vehicle. We should start looking at times and places and routes that work well and ones that do not. We want to start looking at times of day when they're at their best for driving and use those times of day to maintain skill sets. But start to look at, do we want to start switching roles on those other times? And to begin the art of looking for alternatives. And as Debbie said, recheck every 6 months, at most a year. And if there are problems, this is where you need to get help to think it through before you do anything. Don't start a conversation until you're ready. You need to think it all the way through and only then raise the concern. And you want to think about how is the concern based on that individual. You need to know your person. You want to think about driving skill. Are there things that you need to know about personality or history or medical or other sensory conditions? I have on occasion helped people stop driving because of their diabetes and their vision changes with diabetes, much more than their dementia, because in fact, their sensory changes in their hands and in their feet and the speed at which they're able to do things and their eyes, their vision because of diabetes. I can help people stop driving due to that and not have it be about dementia at all, because it's actually about some of the symptoms of their diabetes as much as it is about their dementia. And they can get the symptoms of diabetes they can under their symptoms of dementia. Also looking at the times of day and routines that they flow. Personality traits really do matter. And we also want to look at what other drugs the person might be on that might be affecting their cognition. Because people can get on a whole boatload of drugs and it can look like they're poor at driving when what we've done is they've gotten so loaded up on drugs. Somebody actually needs to look at that whole story to find out, are they on a number of medications that are impacting their ability to do things? So sometimes working with a nurse practitioner or physician can make a difference in a person's ability to a speed of reaction that's adequate versus it isn't. So this information that I'm going to just lay out here on the PowerPoint is who's going to talk about it, how are you going to talk about it, and if the person won't stop, then we need to get help. Because if the public is at risk, we do need to take responsibility. But we need to figure out who's the bad guy and who's the safest bad guy. I think all too often we ask a spouse or a child to become the bad guy, and that puts them at risk. And I think that's unfair and it's unwise. So we need to get smarter as a society and as a support, making better choices and help families and individuals make better choices. So I'm going to pause here. I want to thank everybody for being here. And I hope you're walking away with what you didn't come in with.
Wow, that was a lot of information. Let's sum it up. Driving safety with dementia is a really complex issue, isn't it? It's important to understand the full impact that driving retirement has on an individual. It's confusing and actually unfair that our society does not have standards to gauge driving safety based on abilities rather than just age or a diagnosis such as dementia. Having a plan is crucial to handling this conversation well. There's a lot of information to gather before even starting the conversation. We need to think seriously about acknowledging an individual is unsafe, yet we still avoid the issue. Doing this can have serious and irreversible consequences for all, not just the driver. There are effective ways to support a person who should no longer drive using skills such as empathy and I'm sorry, this is really hard. Before we go, take a look at this last slide. You probably were interested in this webinar because you have someone in your life that you think might not be so safe anymore behind the steering wheel. Maybe you've noticed some of those signals that Teepa mentioned, or maybe you're just curious about this subject. What have you learned that will empower you in this area? Are there other people you can share this information with? We hope this webinar has been helpful to you. Thanks for joining us. Please visit our website at teepasnow.com for other helpful resources. I'm going to show you 3 links to some great resources that might interest you. One is the Care Partner Support Series, where you can learn skills and share ideas with PAC leaders and other people like you on this same journey. A second one is a resource such as the Dementia Caregiver Guide book. And thirdly, we have consultation services available with a PAC professional who can help you navigate those challenges of being a care partner. Thank you again for watching.